Hello all, I am Dr. Walter from SNS College of Physiotherapy, and today we are going to see a case presentation video. First, I welcome our final year students for this case presentation video. So today we are going to see a case regarding the Parkinsonism. Okay, students, you might have learned Parkinsonisms from third year. Yes or no? Yes. So in clinical neuro, and now you are learning in PT neurology. Okay, so in clinical neuro, you have learned the drugs, medications, and other procedures. And in PT neurology, you will be learning the different techniques you will be applying for the patients. Okay, so I'm going to say a patient of 65 years old female. Okay, so in PT neurology, we will be writing the assessment based on the age and all the other factors. In PT neurology, we will be learning the assessment. So how to treat patients? Now this 65 years old female, so I met her before 1 year. Okay. Now during this 1 year of physiotherapeutic treatment, so I applied different types of treatment techniques on her. Okay. So I mainly concentrated on the gait patterns and the posture. As you know, if a Parkinson's patient is affected, so what will the posture outcome? A stooped posture. Yes or no? So now going for the clinical neurology. So which part of the brain is getting affected? The substantia nigra. And what is getting low? The dopamine secretion. Okay. Now in PT neurology, you will be learning and how to implement certain factors. That is the gait, posture correction, okay, balance, coordination, all these things you will be learning. And the most important thing is you need to reduce the tremors. Okay, and some other cases in extreme conditions of tremors, patient will be going for the deep brain stimulation. So that is going for the surgery part. Before we are giving up, okay, as a physiotherapist, we should not give up. That is the most important thing we need to understand. In all fields, okay, in all the fields, in some cases they will give up, but in our field, in a physiotherapy field, we should not give up. Now, what happened to the 65 years old female? Okay, after continuous of 1 year of treatment, physiotherapy treatment, she gained the balance, the coordination, the reduction in the tremor, and the response, good response in the gait patterns. Okay, so what I implemented in the gait, the backward gait training. Okay, so you might have learned in exercise therapy and all the forward gait training, the step gait training, so these types of training. But what is backward gait training? So I'll be keeping some blocks, okay, for 1 meter like that. Okay, so I need to ask the patient to first look on to the blocks, how many blocks I have kept. Now I'll be keeping the patient onto the last stage. Okay, and I'll ask the patient to carefully move backwards. In initial stage, as a physiotherapist, we need to support. Okay, we need to support the patient by holding his or her hands. So I held her hands, and she made certain attempts to gain the backward gait training. Okay, first I attempted the backward gait training, and next I went for the postural correction. Okay, postural correction on basis of the first thing, she was unable to get up from the bed. Okay, first thing, getting up from the bed was very low for that patient. Okay, so I implemented the pelvic floor strengthening exercises. Okay, pelvic floor strengthening exercises, Kegel's exercises, and all these exercises was very much helpful. Then the quadriceps strengthening exercise, static quads, which worked out very well. Okay, now can you might ask whether this physiotherapy treatment alone will help out. I'll say you need to be a cooperative with the physicians also. Okay, as neurosurgeons, they will be giving the dopamine medications, levodopa, carbidopa, combinations of medications, and you need to suggest the patient, you need to take the doses as much regular. Okay, because in one hand the strengthening training, the gait training is going on, on another hand the supplements for the dopamine secretion should be implemented. It is in the form of the levodopa or the carbidopa. Okay, So what is the outcome of this 65-year-old patient? Now she is doing her ADL activities on her own and she is better now. And even though she is having certain limited amount of tremors, and still now she is doing all the exercises which I taught her. Okay, so it is not about this physiotherapy like we'll be teaching for one day and she will be leaving for another day. No, regular basis exercises is much more important in the physiotherapeutic field. Even though we are not going to the home cases after a year, we need to follow up in the phone calls as they are doing well, or we need to visit their places and ask their healthy status. That is the most important thing that as a physiotherapist we need to adapt. As we have learned in first year psychology, we need to think of their psychological status and we need to implement these things. Okay, so we'll meet on next video with a different technique. Thank you.